Hi everyone, hope you're all keeping well. This is Andy from We Are Wellbeing. Today's session is on men's health. So this is a short half an hour webinar on different subjects related to men's health and trying to include the conversation and break some of the stigma. So this is something that we put together a few years ago, and obviously we've updated the content since. So, first of all, what we're going to cover in the session is we're going to look at some of the men's health statistics. We'll look at mental health awareness, some little touch on screening and self-assessment, the kind of things that we should be looking to control or manage personally. And then we'll do a bit of a summary. So, first of all, thinking about some of the mental health concerns. So normally when we do this as a live webinar, I'll ask you guys as the audience, what do you think are some of the main concerns related to men's health? I know when I was starting to research this and to look at some of the subjects, I thought the main things we're going to be looking at is prostate cancer, testicular cancer, and then maybe male specific health concerns. I'm quite interested to kind of see the results really, and concerned as well at the same time. So this is some of the men's health stats that we pulled up. So we've got 19% of all male deaths are under the age of 65. Now, as a guy, I've got to 40, thinking if as an average, I might have 25 years left. That's a pretty worrying concern. And a lot of this is related to poor lifestyle choices, not exclusively, but generally. And what we know is, generally, the general consensus within public health is that people are living, especially in Western society, we're living longer. We're living longer because medicine's pretty good. We know that access to good healthcare is a lot better than it used to be. So we're living longer, but people are not living longer in good health. Most people are living, the last sort of 10, 15 years of their lives in ill health. And that's really something that we want to start thinking about. As someone who's 40, I do think now, obviously I spend more time thinking than most because it's the industry that I work in. But I do think about what I want to be like when I'm 60. What do I want to be like when I'm 80? And by starting to do some of the stuff now, like exercising, mobility work, and strength and condition, those kind of things, not for sports performance. It might have been that when I was younger, but now definitely it's much more to think about what do I want to be like when I'm older. We've got ischemic heart disease is the leading cause of death in men in the UK. Obesity, 26% of UK adult males are classified as obese. That's not just overweight as well. So anybody over a body mass index of 25 or above is classified as overweight. And this idea of obesity is, you think about, larger than life individuals that are morbidly obese. That's not what obese is. You don't have to be that far overweight to be classified as obese. And usually when we do health assessments, people are often quite surprised that they get classified as obese. Now, obviously, we look at things like body mass index, and body mass index can be a bit misleading at times. So you need somebody to interpret it more appropriately. But looking after your weight and managing good weight management is a really useful thing to be considering. Lung cancer is the leading cause of cancer-related death in men. Prostate is the second most common cancer-related cancer in men. Suicide is the leading cause of death in men aged 35 to 49. I also think it's the biggest killer in men and women under 35 as well. So suicide's a huge concern. Obviously, we talk about that and the stigma associated with poor mental health and well-being and suicide risk. We're doing a lot more than we used to do, but it's still way off what we need to be. And then 3/4 of all suicides are men. It's the biggest killer in men under 35. So when we think about men's health, when I started thinking about men's health, I wasn't really thinking about suicide. I wasn't really thinking about lung cancer. I wasn't really thinking about necessarily ischemic heart disease. But these are some of the big major concerns, and not so much things like testicular cancer. And obviously, prostate cancer is a big concern, but it's not in sort of like the top few. This is something I put together looking at the primary, secondary, and tertiary causes of premature death in men based on their age bracket. So for primary causes of death in men under 20, it's suicide and injury, again in the 20s to 34 category, or all the way up to 50. The leading cause of premature death in men from probably 10 to 49 is suicide and injury. I'm not sure what the stats are under 10, but that's pretty worrying, and that's a major concern. And as somebody I've got friends who have died by suicide, it's absolutely something we need to be talking more about. And as an organisation, as a wellbeing trainer, that's something absolutely we dedicate our time to. 50 to 64, heart disease. So this is cardiovascular disease. So things like heart attacks, obviously not necessarily strokes, but strokes is a brain attack. But when we look at cardiovascular disease generally accounts for, I think, about a quarter of all deaths in the UK. And that's not people dying from, birth defects or congenital heart defects of birth. This is people who are generally dying as a result of poor lifestyle factors and not looking after ourselves as well as we should do. Heart disease again for 65 to 79, and then 80 plus is dementia and Alzheimer's. But when you look through all of these primary, secondary, and tertiary causes of death, there's no mention of prostate cancer. There is no mention of testicular cancer. So those male classic things that we think about are big men's health concerns. Obviously, they are a concern, but they're not in the top three at any age bracket. So the main things we need to be considering is heart disease, things like you got accidental poisoning in there, which often relates to things like drugs and alcohol, and then you've also got suicide and injury. So these are the things that we should be paying extra attention to. So when we talk about mental ill health, there's a risk factor then. Things that can increase your risk factor of experiencing poor mental health could be things like as we get older, or being of a specific age. Stress, absolutely. You're much more likely to experience stress before you experience some sort of mental health condition. So if you are experiencing stress, look at how to manage that. Any kind of trauma goes without saying, and then lack of support and family history as well. You're more likely to experience poor mental health if you've got poor mental health in the family. The things that we can do is talking more, normalising the conversation. One of the big challenges, and obviously this is a lot of the stuff that we do, most of the stuff that we do is related to workplace wellbeing. And what we know is that wellbeing at work, people are much more unlikely to put their hand up and disclose that they're struggling with mental health, probably because they're in their job. And I don't particularly like the term, but it's often referred to as career suicide. So what we need to do is get to a point where people feel comfortable enough to disclose that they're struggling. And it's a bit like when we look at the wellbeing curve and we look at how people go through life. And you've got people at the top of the wellbeing curve who are thriving. You've got people who are halfway down who are going through a bit of a rut. And then you've got people at the bottom of the wellbeing curve who are in crisis. My opinion on this is that too much of mental health conversations is about how do we support those individuals in crisis. And it's like firefighting. And what we need to do is start to think about giving people who are well the tools and the resources and the insight to know how to look after themselves. So actually, when they do inevitably hit one of life's tough times, they're much more capable to be able to deal with it. So that's part of it. Also, having a really good understanding of what resources are available. We know now more than ever the NHS is stretched, and if I was to walk into my GPs today and say that I was struggling with my mental health and I was feeling depressed, the chances are I'll probably end up getting antidepressants way before I'll get offered counselling, just because of the accessibility to it. So things like organisations having an employee assistance program, being able to use those resources, that's a really good benefit. But also then having check-ins, making sure that you're checking in with your family, checking in with your friends. These are things that we should all consciously be doing, not waiting for things to get worse. Then we've got ischemic heart disease. So the figure or the diagram that you can see on the right-hand side, that's what we call the process of atherosclerosis. It's this gradual build-up over years of these fatty plaques in the arteries. The idea is that those fats get laid down through poor food choices. So when we do a finger prick cholesterol test, we often look for the LDL and the HDL cholesterol. So the LDL being what we call the bad cholesterol, the LDL being called what we call the good cholesterol. And the LDL, these bad fats that come from biscuits and cakes and red meat fats and all the good tasty stuff, unfortunately, is associated with that. Now, the bit of misinformation is that most of that comes from your diet, and that's not necessarily true. I think I remember reading about 70 to 75% of the LDL cholesterol that we produce is actually naturally produced by the liver. So you could have somebody like my father-in-law, for example, is Spanish, lives on a hill in Spain. He has a complete Mediterranean diet, but has had multiple heart bypasses, not because he consumes vast amounts of saturated fat in his diet, but because he's got a naturally high occurring production of LDL cholesterol. So one of the important things to do for managing your own physical health is go and proactively go and have a health check. Go and get a blood test, go get one of these finger prick cholesterol checks. These are the kind of things that we do in businesses, but that's definitely something that's worth looking at. So the risk factors of ischemic heart disease is things like age. As we get older, that increases. The hardening of the arteries can happen as a result of smoking. If the arteries become harder and rougher, the fats are much more likely to stick to them. Obesity, so increasing obviously body mass, that also puts more outward pressure on blood vessels. It increases blood pressure. Poor diet, poor family history, or family history of heart disease as well, that can increase it. And as far as the screening kind of things, the kind of things you can do to proactively reduce and monitor your risk of heart disease, things like having an ECG, so an electrocardiogram, having your blood pressure checked regularly. You can buy pretty good blood pressure machines at home. You don't want to become obsessive over it because you end up turning yourself into the worried well. But what you can do is have a blood pressure cuff, you stick it on your left arm, and you check it when you're laid down and relaxed once a month. And just being familiar with what your blood pressure is really important, because if you start to notice it's trending upwards, then you want to do something about it. Most people who end up on blood pressure medication, they're on it for the rest of their lives. So as a health and well-being coach, I would always recommend that people try and get their blood pressure down naturally than relying on medication. Because with any kind of medication, there's always contraindications that could also lead to needing other medication. Exercise testing, so we can look at people's blood pressure response to exercise. You can have a normal blood pressure when you're resting, but as soon as you exercise or get stressed, it might peak and skyrocket. So it's also worth being aware of that. Your lipid profile is basically your cholesterol test, so you can look at those. And then more advanced heart disease screening also includes things like arterial scans. There's really, there's a lot of opportunity now to stay well in the know when it comes to heart disease. When you get lung cancer, obviously highly associated with smoking, passive smoking, but also can be related to the kind of job you do. So if you're working with chemicals or you're working in manufacturing where there's changes to the environmental factors, pollution and radiation can all increase risk factors of lung cancer. As far as screening, the kind of things that we would look in is things like having a chest x-ray, a low-dose CT scan, bronchoscopies where they'll put a camera down into your lungs, biopsies if they find anything and they want to take away and analyze it, but also doing simple things like a lung function test. As part of our, I think our essential health screens, we do a peak flow test where it's a bit like an asthma test where we're looking at the force of the lungs, but we can also do things like a lung function test where we look at the forced expiratory volume, so how much air can you force out in the first second, but also looking at the full capacity of the lungs. Now, if they dramatically change over time, there's no real explanation for why they would change over time. That could be an indication to go and get further tests. So it's about paying attention to what we call the observation of change. If you notice something that's changing and there's no real reason why it would change, that's worth an investigation. Then we've got prostate cancer, so obvious male big cancer risk. I think it was the second leading cause of cancer-related death in men. Risk factors include age, smoking, so if you're a smoker that can increase that, obesity, having poor diet generally, and again family history, a lot of the similar trending kind of things that we've seen on here. As far as screening goes, now there is something called a PSA blood test, a prostate-specific antigen. Now, this can test traces of the hormones that are released if somebody does have an enlarged prostate as a result of a cancer, but it's not a diagnostic test alone. So one of the things that we're seeing lots of organizations now offering just PSA test, but without any kind of medical context, it doesn't really provide enough information for individuals. So you couldn't have a PSA and just get diagnosed. There's additional information that needs to be done with it, almost like a bit of counselling, if you like. A DRE, a digital rectal exam, not Dr. Dre, as some people mistake it as. So the DRE is a digital rectal exam. So this is where a doctor will, or a clinician will, place a finger up your backside and feel for the prostate gland, and if they're looking for the density of it, looking for the size of it, looking for the feel of the outside of it, to see the consistency of it, to see if there are any kind of dramatic changes, and to see if there's anything that's that's wayward. Now, on the NHS, I don't think you get offered one of these, any kind of prostate screening, until you're over 50. Now, I know a couple of guys in my world who have died from prostate cancer, and they weren't even at the age where they would get offered the screen. Now, I've been to my GP and said, look, I'm concerned just because I've had friends that have died by prostate cancer who weren't at the age of the wanted screening. Can I get a screen? And have been turned down. So for me, a peace of mind kind of thing. I just paid privately, went to a private hospital, went and had a Wellman health check, and said, look, I know I'm not of the age, but I still want to have this test done just for the peace of mind. Fortunately, everything was all right. But I think when it comes to health screening and being health aware, you don't want to be someone who worries about your health. I know Dr. Sam, one of our medical directors, our medical director, he runs emergency medicine at Bradford, and the thing that he sees more than anything else in the emergency room is health anxiety. So we don't want to go down the route of worrying about our health so much that it has an impact on our health, but also we don't want to be closed off to it. What we want to do is think about how do we manage our manageable health. And I think sometimes you've got to be proactive. Yeah, the NHS, unfortunately, is so stretched that they're not as able to be proactive as we'd hope. So some of these things you might want to take into your own hands. Then we've got ultrasound, so they can actually do an ultrasound of the prostate to look at the density of it and the consistency of it. Also things like biopsies, if they do or notice anything, to take a piece of that away and analyze it. But also things like urine analysis can spot traces of things like protein and blood in the urine. Having blood in the urine isn't just like going and peeing red. You can often have pee in your blood and there's no visible sign of it. But doing one of these dip urine tests can also do that. And that's a fairly cheap and effective way of doing it. Then we've got testicular cancer. So major risk factors of testicular cancer, and this is what we classify as like a young man's cancer, would be undistended testicles, so where the testicles haven't dropped fully. Family history, if someone's had HIV, if you're aged between 20 and 34, hence, a young man's cancer, and also having had a prior cancer. So if you had a testicular cancer before, you're much more likely to get testicular cancer again. As far as screening and self-assessment, the first port of call, or the first barrier of protection is self-assessment. Now, as guys, what we know is that we want to check the testicles when we are warm. So you don't want to be doing this on a cold day. Definitely don't want to do it on a cold day. That's just depressing. But what you do want to do is check when you're in the bath, check after you've had a shower. If you've been in the sauna or a hot tub, something like that, and your body temperature's increased. And what you want to be able to do is, a bit like where women will do breast cancer screening, they'll roll their hand over the breast to check for any inconsistencies or lumps. What we want to do is roll our thumb around the testicles all the way around, feel the tubes, and we check for any hard lumps or inconsistencies. And again, get to know yourself, get to know your own testicles, and notice anything that's different. When it comes to health and well-being, it's all about the observation of change. Do you notice something that's there now that wasn't there before, however different it is? So first of all, it's self-assessment. Then it's going for maybe a doctor assessment where you get a doctor to confirm and do a testicular check. It could be then having an ultrasound. It's a bit like pregnant women will have an ultrasound on the stomachs. We can have a testicular ultrasound to look for any density or inconsistencies. Markers in the blood, so having a blood test can also identify some of these risks as well, but also then again having a biopsy. So testicular cancer is what we would be trying to be more aware of there. Then we've got this called andropause. Now this is something that a lot of us haven't heard of. It's not something that we'll be too familiar with. It's not actually, especially here in the UK, it's not really even a medically recognized term, I guess. So if you imagine when women go through the menopause, it's this fairly, I know it takes it's years, but it's in a fairly short space of time is a massive dramatic change to the production of female hormones, estrogen. And there's a lot of other medical things that can happen, a lot of other reactions that can happen, and over time it's heightened because it happens in a relatively short period of time. For guys, this has been labelled by some individuals as the male menopause. I don't particularly like calling it the male menopause because it's not comparable. But what it is this gradual lowering of testosterone over time. And if you think, the way I think about testosterone is, testosterone's kind of like the thing that makes me feel like a guy. It's the thing that gives you sex drive, the things that gives you that ability, that motivation. It gives you that drive to want to exercise. It increases, if I've got higher levels of testosterone and I exercise, I'll see better results. Obviously see that in sports performances and stuff that people get banned for. But generally speaking, it's this gradual lowering of testosterone. Now, it can be associated with a number of different things. We know that men in their 40s and 50s have a much higher risk of suicide. Now, I'm not saying it is something to do with it, but I think it's important to ask the question, could it be something to do with it? I definitely know that if I feel motivated and I feel stronger and I feel more empowered and I've got sex drive and I've got, energy, that's all stuff that makes me feel more positive. And if someone was to take that away from me, I can absolutely feel that my energy levels would dip. Now, here in the UK, we're only just starting to see TRT, so testosterone replacement therapy. In America, it's much more commonplace where people can go to their doctor. I have a test for a testosterone test, identify if their levels are low. There's loads of it in social media now, so you'll probably notice that there's more call for this kind of stuff. So in the next few years, you probably will start to see more guys having testosterone replacement therapy, just to keep them well and to keep them youthful. I personally, as soon as I'm going to get offered it, I'm going to definitely take it. Because I think it's a really important aspect of men's health personally. But obviously you've got to follow the advice of your doctor. But watch this space. I think it will become much more commonplace in the next few years. But the other things you can also do is exercising and eating a healthy diet, being more mindful of the food that you're putting in and the exercise and the movement that you're making. We do want to, things like weight training naturally increases your testosterone levels. So there's a lot of things there that can do that. So that, yeah, if that's something that you're affected by, that might be another area that you want to go and research and spend a bit more time looking at. So it's called andropause. And then obesity. It's funny with obesity. Sorry, I keep tripping over the dog that stood behind me. Laid down behind me. When it comes to obesity, we often talk about mental health and the stigma associated with poor mental health, and it's a sensitive subject, and we shouldn't, people find it difficult to talk about. I find the opposite. So I go into companies every single week talking about mental health, talking about suicide, and having these conversations, and I have them for years. I've been working in workplace wellbeing for about 15 years now. And what I can tell you is in the last 15 years, I bet I've been invited into companies to talk about overweight and obesity no more than 4 or 5 times. So when we think about stigma, I think there's a way more significant stigma associated to obesity than there is mental health, personally. And when we think about the risks of ill health associated to obesity, we've got type 2 diabetes, coronary heart disease, stroke. Strokes are the leading cause of disability worldwide. Certain types of cancers, metabolic syndrome, all the things that are associated with having a higher body mass index. Now, just quickly on body mass index is your weight to height ratio. So obviously it's just your weight. What is your weight in relation to your height? So it misclassifies a bunch of people. If you had the England rugby team, they would all be overweight or obese because they've got high levels of muscle density. So it can't be used for specific populations. But what we don't have in the UK is we don't have a bodybuilding epidemic. We don't have an epidemic of people walking around with massive amounts of muscle. We have an overweight and obesity epidemic. So one of the things that the body mass index is good for is looking at the general population. So for most people in the UK who have a high body mass index, they will have it because they've got too much body fat. Yeah, not because they've got high amounts of lean tissue. So what we do is, in addition to body mass index, we also use waist to hip ratio, and this helps us to further classify someone's body mass. But we can also do things like bioelectrical impedance testing, body circumference and testing, just to obviously further classify it. It's all about the interpretation, really. But looking after your body weight is crucial. We've then got liver disease. Now, liver disease is an interesting one. I remember speaking to, again, Dr. Sam about this. Now, in America, there's 2 different types of liver disease, or main liver disease, really. You've got fatty liver disease and you've got alcoholic liver disease. In America, you've got huge amounts of fatty liver disease as a result of things like poor diet. In Eastern Europe, there's high amounts of alcoholism, so they have a lot of alcoholic liver disease. And in the UK, quite unique in the sense that we've got both. We've got high amounts of alcohol and we've got high amounts of poor diet. So liver disease is a real concern. So since the 1970s, deaths due to liver disease have increased by 400%. Liver disease is the third leading cause of premature death in the UK, and 90% of liver disease is preventable. So this is something that we want to be paying attention to. You know, when we're looking at drinking culture, when we're looking at, I know through COVID, we do a lot of work with people who work in hospitality, and hospitality's seen a massive shift where people are drinking less out and about and drinking more at home because it's cheaper. If you're drinking more at home, you're pouring your own shots, you're pouring your own measures. You're definitely not getting a shot glass out to measure your drinks. So we're starting to see this creep up even further. So this is something we need to be even more aware of. So as far as health and wellbeing screening, at different ages, so things like diabetic eye screening starts from the age of 12. You can have that done through your optician. Online heart age tests for the over 30s. So if you know your height, your weight, your blood pressure, and ideally if you know your cholesterol score, we can also do a cardiovascular risk assessment. And the cardiovascular risk assessment is using NHS data, years of NHS data, and we can give somebody a cardiovascular risk score of how likely it is they'll have a heart attack in the next 5 years. So the data around that's really, really useful, and that's something that we really sing and shout about when we do health screening, is being able to give people really pretty accurate risk factors based on their current scores. Then you've got bowel screening from the age of 60. So this is what we call a hemoccult test, where you basically place a little bit of poo on a tray. We send it off for analysis. We put some drops on it, and that will identify if there's blood in the stool sample. If there is, then obviously we then send you off and go for further screening on your NHS. And then you've got well man and well woman health screening. Now, this should happen at 40. So the well man and well woman screens, I think it's inclusive of things like an ECG, a comprehensive blood test that looks at your total blood sample, which includes things like your liver function test, your kidney function test, your lipid test or your cholesterol tests, and then like your full blood count as well. Red and white blood cells, all of that. Now, they should get offered at 40, but it seems to be fairly inconsistent. Depending on which NHS trust you live within, depends on whether you get offered it soon, later, or even at all. Now, what the concern is, as someone who works in health screening and works in health and wellbeing, is this: if we're not doing as much preventative screening, what's going to happen is we're going to have more people going to their doctors with things like, instead of finding stuff in stage 1 or stage 2, we're going to start finding people with cancers in stage 3 and stage 4, which are less treatable. So my recommendation to anybody that I meet, anybody that'll listen, is be proactive. Don't worry about your health. It's not something you want to be sat around worrying about and, increasing likelihood of poor mental health. But what you do want to do is take control of your manageable health. Do the stuff that you should be doing, moving your body, eating a generally healthier diet, drinking plenty of water, socializing, do all the stuff that keeps a human being well, and take action for yourself. So if you do feel like you're at the age where you need a screen, go and ask for one. Don't wait to get written to, go and ask for one. My experience was I needed to have a health screen before an operation. I was on back surgery probably about a year ago, and I needed to have an ECG and a blood test. So I went to my local GPs, and what they do now is they've got what they call health technicians. So they're not doctors, they're not nurses. This is somebody that's been trained to be able to administer the tests. So it's like a low skill level health provision. But what they'll do is they'll do the test for you, and then they'll get interpreted by the experts. And that's a lot more accessible. So that's something that you should look out for if you can get access to it. You've got DRE, so digital rectal exams for prostate cancer for men over 50 and then over 65 as well for dementia. So managing the risk, the kind of things that we should be doing, and this is it's like repeating myself over and over again, because this is the stuff that is often the same kind of advice in most of our webinars and most of our health seminars. And it's drinking plenty of water, so 2 liters a day, 6 to 8 glasses of 250 mils per day, maintaining a healthy weight, going for regular checkups, and being clear on how you manage that yourself. Eating a generally healthy and balanced diet. That's not me saying eat salads and rabbit food all day long. That is not the case at all. And I would be a massive hypocrite because I don't do that myself. But generally eating a healthy and balanced diet, home cooked food, you know what's going in it. Treating yourself when you need to treat yourself, but generally most of the time having healthy food. Hygiene, obviously adhering to good hygiene standards. And then being physically active. The benefits of physical activity are unreportable. Like there's not unreportable, but there's so many to list that you wouldn't be able to list them all. And what's interesting is not just from a physical health perspective, but from a mental health perspective. So physical activity has been clinically proven to be as effective on mild to moderate depression as taking antidepressants. So if you're wanting to improve your mood, if you're wanting to improve the level of the depression that you're experiencing, if you wanted to improve your anxiety levels, if you wanted to improve your stress management levels, exercise is an amazing tool. Can't recommend it enough. So in summary, major risk factors, things like ischemic heart disease, prostate cancer, testicular cancer, mental health. If anybody under 55, that is your biggest risk to premature death. Take positive actions, do the stuff that you need to do well. When I always think about it, is if it's like if you bought a human and it came with a guidebook, like what are the basic things that you would need to do to keep that human well and thriving? And it's moving, it's good sleep, it's providing with decent nutrition, all the basic stuff that a lot of us tend to forget about. So we don't need complicated health plans. You don't need 1,000 supplements. Just get the basics right first. Don't overcomplicate your health and well-being. Stick with the simple things first, and then the rest of it will follow. And then also regular screening as part of the stuff that we've talked about. This is the bit where I ask for any questions. So if you do have any questions, obviously, you can post those to me. Obviously, this is not a live session. But if you do have any questions, reach out to us and I'll be happy to answer. If I don't know the answer, we've got an amazing team of allied health professionals that will be able to help. So feel free to reach out on that. If you do need any more information, or if you do want any kind of help from We Are Wellbeing, you can get in touch with us. There's hello@wearewellbeing.co.uk or www.wearewellbeing.co.uk. Hopefully you found that interesting. Hopefully you found something useful from listening to this session. Thank you all very much, and I'm sure I will see you all soon. Take care. Okay, watch out.